Let's talk about the new American dream. It's not about owning a home with a white picket fence anymore. It's about wanting a miracle drug, a quick fix, a magic bullet to solve a complex problem, only to find it guarded, heavily guarded, by a maze of bureaucracy, a seemingly endless mountain of paperwork and procedures, and a health insurance rep named Brenda, who's probably just as frustrated as you are, who, bless her heart, loves saying no. It's not personal, it's policy. I'm talking about Ozempic, Wegovy, Mounjaro, the so-called golden tickets to weight loss, the darlings of social media and the hopes of millions. The hype is real, the before and after photos are compelling, but so is the sticker shock. Prepare yourself. Getting these drugs in the US isn't a pharmacy run. It's an extreme sport. It's a quest. Imagine the Hunger Games, but you're fighting insurance phone trees, those automated systems designed to wear you down. And sky-high prices. May the odds be ever in your favor, and your wallet. You start hopeful with your doctor, armed with research and optimism. But then, the pharmacy calls. That'll be $1,200 for a month. Suddenly your miracle feels like a financial nightmare. The dream deflates. The real obstacle course is just beginning endless insurance calls, each one a test of your patience, denials, stamped with bureaucratic indifference, appeals, a Sisyphean task of filling out forms and gathering documentation, and hours deciphering jargon, trying to understand the fine print that seems designed to confuse. People spend lunch breaks on hold, the hold music a soundtrack to their frustration, evenings buried in paperwork, a second job no one signed up for, all for a shot at better health. Literally. The system seems designed to make you give up, to wear you down with its complexity and cost, to settle for less, to accept the status quo, to accept that maybe being overweight or dealing with the health issues that come with it is easier than fighting this battle. But is it really? It's a uniquely American blend of cutting-edge medicine, groundbreaking scientific advancements, and soul-crushing red tape. A frustrating paradox. Fun, right? In a world saturated with quick fixes and fleeting trends, a palpable sense of desperation hangs in the air. People are searching, yearning for something that truly works. Why are people so desperate for these drugs? What is fueling this intense desire and demand? Because for once there's a glimmer of hope, a sense that real change is possible. They actually work. These medications aren't just another fad. They're delivering tangible results. Decades of yo-yo dieting, countless failed attempts, and the emotional toll of weight cycling have left people exhausted and disillusioned. And suddenly, GLP-1 agonists, a new class of drugs, emerge as a potential game changer. Like Ozempic, a name that has quickly become synonymous with weight loss, and Wegovy, another contender in this revolutionary field, offer real, sustained weight loss, not just a temporary fix. Sometimes 15% or more, a significant and clinically meaningful reduction of your body weight. That's a number that speaks volumes to those who have struggled for years. These drugs mimic a hormone, GLP-1, naturally produced in the body. That helps you feel full, signaling to your brain that you've had enough. So cravings drop, the constant battle against food noise quiets down, and eating less feels natural, not like a constant act of deprivation. For many, it's not about vanity, chasing an unrealistic ideal. It's about lowering the risk of diabetes, a serious and widespread health concern. Heart disease, another major threat to health and longevity. And reclaiming quality of life, being able to move more freely, participate in activities, and simply feel better. But here's the catch, the looming obstacle that tempers the excitement. The price, the exorbitant cost of these potentially life-changing medications. In the US, a month's supply, a mere 30 days worth of medication, can cost $900 to $1,300, a staggering sum for many Americans. Out of pocket. And that's before insurance, if you even have it. Mounjaro? Even more. A newer drug with an even steeper price tag. Meanwhile, in Canada, just across the border, the same drug is $200, $300, a fraction of the cost in the United States. In Europe, where healthcare systems prioritize affordability, sometimes under $100, an almost unbelievable difference. Same drug, same manufacturer, the exact same product rolling off the assembly line. wildly different price tags, a glaring disparity that begs the question, why? What explains this dramatic price difference? Because the US system operates under a different set of rules. Let's pharmaceutical companies, the giants of the industry, and middlemen, the pharmacy benefit managers and other intermediaries, set prices with little oversight, allowing them to dictate the cost of medication. No government negotiation, unlike many other developed countries. No price controls, no mechanism to keep costs in check. Just a free-for-all, a market driven by profit rather than patient well-being. Americans end up subsidizing, effectively paying for, lower prices abroad, shouldering the burden for the rest of the world. While at home, these drugs, these potentially life-saving medications, are priced like luxury goods, accessible only to the wealthy. The result? The unfortunate and unjust outcome, a miracle drug, a breakthrough medication that could transform lives. That's out of reach for most, a cruel irony in a country that prides itself on innovation. It's less a magic wand, a simple solution for everyone, more a diamond-encrusted scepter, a symbol of privilege and exclusivity. And the frustration is real, a palpable sense of injustice and anger. You'd think insurance companies, whose very purpose is to provide financial protection against health risks, would jump at the chance to cover drugs that fight obesity, right? After all, obesity is linked to so many other costly health problems. Think again. For most people without type 2 diabetes, who are seeking these medications specifically for weight management, getting coverage is like teaching a cat to file taxes. Frustrating, time-consuming, and probably impossible. Ozempic is FDA approved for diabetes, making it somewhat easier to get coverage if you have that diagnosis. Wegovy, on the other hand, is specifically approved for weight loss, but insurance companies still throw up endless hurdles, creating a labyrinth of requirements. They demand months of meticulously tracked, often failed diets, strict BMI cutoffs, often ignoring individual health context, and step therapy with older, often less effective drugs. Even with diabetes, a condition Ozempic is designed to treat, prior authorizations and denials are common, adding layers of complexity. Doctors drown in paperwork, spending countless hours battling insurance companies, patients wait and worry, their health hanging in the balance. The system seems designed not to facilitate care, but to wear you down, to exhaust your resources and your patience until you give up, defeated by the sheer weight of the bureaucracy, or pay full price, emptying your wallet for the medication you need. It's arbitrary, often with denial codes that make little sense, cruel, adding financial strain to health concerns and leaves people wondering, questioning the value of their coverage, why their health isn't worth the investment, why they're being denied access to potentially life-changing medication. You pay premiums month after month, year after year, but when you need help, when you're facing a serious health challenge, you're told to rely on outdated and ineffective methods, the broken treadmill in the corner, a symbol of empty promises. Welcome to the American insurance game, where the odds are often stacked against you. When the system fails, people get creative, sometimes desperate. Enter the great Ozempic Quest telehealth shortcuts, pharmacy tourism, and online pharmacies. Some fly to Canada or Mexico, where the drugs are cheaper and easier to get. It's often cheaper to buy a plane ticket and the drug abroad than to fill a prescription at home. Others turn to online pharmacies or compounded versions despite safety concerns and FDA warnings. These workarounds are risky, but the alternative, no access at all, drives people to try. The system's failure pushes patients into a world of uncertainty and potential danger. When legitimate access is blocked, people will find a way, no matter the risks. It's a healthcare horror story in real time. Doctors and patients are united in frustration. Physicians spend hours on paperwork and phone calls, begging insurers to approve what they know works. Patients face denials, appeals, and the constant fear that coverage could vanish at any moment. The US drug pricing system is opaque and exorbitant, with no government negotiation to keep costs down. Insurance companies focus on short-term savings, not long-term health. Add in pharmacy benefit managers and endless red tape, and you get a system that confuses and disempowers everyone. It's a Rube Goldberg machine of inefficiency, where patients always lose. This isn't just broken, it's a masterpiece of dysfunction. We're on the brink of medical breakthroughs, but for many, it's just another reminder of healthcare inequality. Miraculous treatments exist, but only for those who can pay or navigate the maze. It's a two-tiered system. The wealthy get the cure, the rest get left behind. The purpose of medicine is to improve public health, not just profit margins. The Ozempic saga is just one example. These same issues plague treatments for cancer, autoimmune diseases, and more. If we can't make life-changing drugs accessible, every new breakthrough becomes a luxury good. Denying access based on ability to pay isn't just bad policy. It's morally questionable. This isn't healthcare, it's health capitalism at its worst. Are we really okay with this? Life-changing drugs as exclusive club perks, health outcomes dictated by income or insurance luck? We have the science, the doctors, the patients, but a wall of financial barriers and red tape stands in the way. The system generates profits for some, frustration and ill health for many. Why do Americans pay more for the same drugs? Why are insurers gatekeepers, not facilitators? Is healthcare a right or a consumer good? These are tough questions, but ignoring them means more people get left behind. The Ozempic maze is just a symptom of a system working against those it should serve. What needs to change? Maybe drug price negotiation, insurance reform, or a new way of valuing health. If we don't demand better, this unfair circus will keep rolling on. And that's no laughing matter.